Dr. Jeffrey Spiegel, facial plastic surgeon in Boston, Massachusetts. And I wanted to speak with you a little bit about the difference between botulinum toxin and filler materials. Many people think that these two are interchangeable, but they're not. They do very different things. Botulinum toxin, which comes in several brand names such as Botox, Botox Cosmetic, Dysport, and others, is used to relax muscles. Now there are certain muscles of your face that, when they're active, cause wrinkling. You can squeeze together your eyebrows, you can raise your eyebrows and create vertical and horizontal lines on your forehead, you can squeeze your eyes together and get crow's feet. And all of these muscles are acting upon the skin to create wrinkles. Now if we relax these muscles in just the right spot, you can reduce their effect on the skin and reduce the wrinkle. We attenuate the wrinkling, we make it look smoother and more natural. Am I going to look plastic? Am I going to not be able to move? Am I going to be able to not show emotion? Those are questions that we commonly get asked. And the answer is, that's not the case unless you want it to be. Some people do come in and say, I really don't want to move at all. Okay, here in Boston, in colonial Boston, most people want to look natural and still show some movement. So we can customize what we do in a way that allows for your muscles to move when you want them to, but not be as active at rest, so that you don't have the constant wrinkles that appear between your eyebrows, on your forehead, or on the sides of your eyes. Fillers, on the other hand, don't have any effect on the muscle movement, and what they do is add volume where volume is lost. It's commonly used, a filler material, in places like the nasolabial fold, from the nose to the lip, in here, creases down here by your mouth. It can be used to augment around the eyes and on the cheekbones. Now, filler materials are good on the lower part of the face where weakening something would be bad. It's okay to weaken a muscle that squeezes your eyebrows together, because while that's necessary for certain emotions, you can have less of that motion and it's adequate. We don't want to weaken anything that moves your mouth, because it can look like you are ill or have had some sort of medical problem. So a relaxing agent such as Botox or Dysport would not be a first choice in the lower part of your face. People will sometimes request it for fine lines around the mouth, and indeed you can be very careful and try to put in just the right amount there where it'll relax the wrinkles without affecting your lip movement in an adverse way. But most of the time you're better off using a filler material to fill in those lines. There are many brands of filler material, and fundamentally they fall in a couple of different categories of either hyaluronic acid, which is a natural water attractant gel, which is already found in our skin and can fill in lines, or a calcium type product, which again is a very natural thing which can provide volume to your face. These materials last anywhere from 9 months to a couple of years, and some of the more recent products, such as Sculptra, when done a few times, will last 2 years or longer. If you have questions about how fillers or Botox are right for you, please feel free to email us or write to us from wherever you're from. You can get information at the website that's on the screen, which is drspiegel.com, www.drspiegel.com, or call us at 617-566-3223, and we'll be happy to answer any questions you may have.